What's up, beautiful people? Another day, another study. As someone who's trained in pharmacology, one of the things that interests me is why different people have varying responses to the same medical treatment or drug. And it really interests me if we can figure out, is there a subgroup or different population that won't respond or a population that will respond? And this study was looking at testosterone replacement therapy in men with low T, or as we say, hypogonadism. We know that testosterone levels drop by about 0.8 to 2% per year after the age of 40, and some of this can be mitigated by lifestyle factors. We know symptoms of low T include things like low libido, erectile dysfunction, fatigue, exercise intolerance, but we also see some cardiometabolic abnormalities in men who have low testosterone problems with blood sugar regulation, blood glucose regulation, decreased muscle mass, increased body fat. We know also that low vitamin D levels are associated with various cardiometabolic abnormalities. And so the authors of this study wanted to see, does vitamin D status mediate some of the effects we see with TRT in regards to metabolic health? And so it's a cohort study. They looked at 3 different groups of people, all of them on TRT: men who had vitamin D insufficiency, men who had low vitamin D but were supplemented, and then men who had normal vitamin D, all of them on TRT therapy. At baseline, the men with low T and low vitamin D had higher levels of CRP, homocysteine, fibrinogen, and urine albumin creatinine ratio. These are all markers of poor metabolic health. The TRT reduced high sensitive CRP in group 1. That was the men who had low vitamin D and TRT. But in the other 2 groups, the men who had normal vitamin D levels, we saw reductions in HOMA-IR, LDL, uric acid, CRP, homocysteine, fibrinogen, and other metabolic markers. And these reductions correlated with increasing testosterone concentrations. And it did not correlate with the vitamin D dose or vitamin D duration. Now, the exact mechanism is unknown. It could be crosstalk between the vitamin D and the testosterone, the androgen receptors. Another possibility is that vitamin D enhanced aromatase production, so increased estradiol levels was mediating the beneficial effect. This wasn't a randomized controlled trial. They excluded vitamin D deficient individuals, and it was a small sample size, but this is enough to generate a hypothesis, and I would love to see a longer or larger randomized controlled trial looking at this issue.